We're here today to sign Senate Bill 227. I wanted to welcome the Insurance Commissioner, Commissioner Navarro. Thank you for being here, and I'd like to speak in a minute. Secretary Walker, thank you for being here. Yes, we're going to hear.
Delaware Governor John Carney signed Senate Bill 227 to strengthen primary care services in Delaware. The bill increases reimbursement rates, requires all health insurers to participate in the health care claims database, and creates the Primary Care Collaborative to look for long-term solutions to the dwindling number of primary care providers in the state.
The biggest challenges that we face, certainly as a state, and I think as a country, is to have a healthcare system that's financially sustainable. And we've been doing a lot of work on that issue with our benchmark, and expect and hope to have more data about how we spend our money. We know we spend a lot of money on healthcare and maybe don't get the results that we should. One of the solutions is to try to right-side the system, and I think that's the ultimate goal as we get the data from the benchmark. And part of that is preventive care and primary care. In this piece of legislation,
Governor Carney said the legislation will force more spending to occur on the front end of the health care system rather than the more expensive back end when people need extensive treatment, including hospitalization. Dr. Kara Odom Walker, Cabinet Secretary for the Delaware Department of Health and Social Services and a board-certified family physician, said the legislation calls attention to the need for more data to understand how healthcare spending in Delaware is proportioned.
Reimbursement and payment policy, but also how we come together to talk about future efforts under the Primary Care Collaborative that was called out in the bill. And I think that's going to be another opportunity for us to continue this work and make sure that we bring stakeholders together to really look at the issues. How do we draw more primary care physicians to stay in practice, to be in practice, to come practice here and serve the state and improve population health? And that is, in essence, a really important part.
The bill was sponsored by Senator Brian Townsend and co-sponsored by Representative David Bentz, and was supported by the Medical Society of Delaware and many other health care stakeholders.